All right, so thank you again for coming to one of these sessions. And to be honest, this is my favorite one. That's probably why I ballooned it out to make actually 2 full sessions out of it. But the history of surgery has the most applicability to anatomy, which obviously I like. And it's just horrific. And horrific stuff makes for great stories. Occasionally inspiring, mostly horrifying. So we'll work with that. And if you have any questions, let me know as we go through it. And I want to give a big shout out to Sosa for hosting this. I believe Sosa, is anybody else co-hosting with just Sosa? Research Club, let's give it up for Research Club. So, hey. So go join their clubs and give them lots of money. Okay. All right, so let's jump back in time. We talked a little bit about trepanation as one way in which the body was incised for certain ends, but we don't really have much in the way of what people were thinking about surgery up until we get to the ancient Greeks and maybe a little bit from the Mesopotamians and Egyptians before them. But the first thing we really have going regarding the history of surgery is the Hippocratic corpus, the teachings that were left from Hippocrates and his students. And they described a lot of different therapeutic methods, but they didn't really go into surgery. And in fact, Hippocrates explicitly forbade his students from what's called cutting for the stone. And these were not kidney stones, these were bladder stones. So if you have kidney stones, you can also wind up with crystals forming in your bladder. These inevitably get bigger and bigger. And he forbade them from doing it because a couple obvious reasons and one not so obvious reason. A couple obvious ones, you're gonna have a bad outcome. It's a very nasty, unpleasant procedure. Recovery is always going to be questionable even under the best circumstances. And by the way, these stones from the bladder were not removed in the way I would have done it, suprapubic. They were removed through a perineal approach. Yeah. So push the scrotum anteriorly, or if there's no scrotum, go between the rectum and the vagina and burrow your way in, grab it with something and pull it out. So those are the reasons Hippocrates forbade his students from doing it. But another one that's not so obvious is there were already people doing it. There were already people who were specialized stonecutters, and it was perceived to be professionally impolite to poach off of their area and to actually try to take that venue away from them. So Hippocratic physicians were distinct from a separate class of stonecutters. And one actually interesting thing about it was there was a real taboo against cutting into the human body. And so if your parent or a friend or someone needed this surgery, you'd arrange for the stonecutter to come. The stonecutter would be paid in advance, and because they were violating your loved one, you had tomatoes and rocks and stuff ready to fling at them as soon as they were done, but you let them finish and they had their payment ahead of time and could run away. So you still put on a good show of, showing that you didn't care for the fact they had just opened up your loved one, but you let them do it to get the stone out anyway. So, long story short, Hippocrates didn't have much in the way of actual surgical recommendations. The next person coming up, obviously, would be Galen. Back in the Roman era, Galen was a Greek physician who did a lot of anatomical research, a lot of surgery, and a lot of medical physiologic research. And he did a lot of experimentation to discover why things worked the way they did. And he was really pretty brilliant. He did a lot of experiments, described how respiration actually works for you first years. He kind of came up with that idea of the diaphragm dropping, the lungs expanding, and the lungs moving in response like a bellows. He figured out that nerves innervate muscles. And if you cut the phrenic nerve, the diaphragm's paralyzed. If you cut what's called the recurrent laryngeal nerve, the voice box is paralyzed. And he linked those observations to the existing humoral theory of disease as well as the pneumatic theory. That's the one where you have pneuma coursing through the nerves, filling up the muscles, causing contraction, and allowing someone to actually move. Now, his system was really pretty brilliant. It was based on experimental observation, but it had lots of errors. A lot of things that were byproducts of him not actually dissecting humans. Other things there because he really didn't bother to experiment very far with things once he'd satisfied himself. So he moved away from surgery once he became the physician to Marcus Aurelius, the Roman emperor at the time. And he didn't start this, but he really did pronouncedly make it worse. The idea that surgery was a manual thing and being a physician was an intellectual thing, and that you shouldn't mix the two, that the manual work and the intellectual work were somehow opposed to one another. And just think for a minute, not just in medicine, think about that ingrained prejudice we have about manual labor versus intellectual work. If someone says, someday Johnny's going to grow up and be a plumber, intellectually you might think, yeah, that's fine, but does that sound like something you would say? Now, be honest, is that something you'd say to someone as a compliment? Plumbers are really smart people, but there's a societal ingrained idea that this manual labor is somehow inferior to more intellectual work, and we're still stuck with that thanks to the Greeks. So, we talked about how, after the fall of the Roman Empire, a lot of the high culture of Western civilization, and medicine especially, moved into the Islamic empires, and the Islamic empires were really very widespread. It was not just the Middle East. All of northern Africa, along the Mediterranean, up into a significant part of Spain, were actually covered by Muslim civilizations and different people in charge, called caliphs, oversaw various areas. Also, Hurari, who I'm sure I'm mispronouncing his name, also called Abu Qasis, was one of those Muslim physicians in the Spanish court at Cordoba, and was the royal physician to the caliph there. And he did some really amazing things regarding vision and surgery. Now, Islamic surgery is pretty much identified with cauterization, because cutting someone was still considered to be forbidden under the rules and regulations of the culture at the time. So you didn't cut someone to do surgery, but if they had a wound, you could still seal it with cautery. And al-Zuhari was able to bring that to a little bit finer practice, make it a little bit better. But he also introduced cauterization alternatives, like suturing with silk or catgut and actually sealing off the vessels that had been opened up. He wrote several influential works, and he did a lot with eye surgery. And one of the really cool things is that he wrote surgical treatises on the eye and included illustrations in there. So we can actually see these are all instruments that were meant to be done or used for eye surgery. So one of the big things that was done with eye surgery was getting rid of cataracts. Now, what are cataracts? Anybody? What part of your eye is affected by cataracts? The lens. The lens gets cloudy and opaque. You can't see through it that well. Practice at the time was to actually push the lens into the vitreous humor behind it. And even though you could no longer focus, you could see a lot better because there's no longer this big cloudy thing in the way of the light. So the stipulation against cutting open bodies didn't seem to apply to the eyes because it was largely done with pressure rather than an incision. But there were some incisions made, and al-Zuhari was one of the people who figured out how to not just push the lens out of the way, but remove it and put the other corneal layers back in place, and you could actually have better vision thereafter. So he used not just cautery, but also looked into using suture to close wounds. And sadly, this practice was largely lost, although it was described in his books until about the 1500s and a surgeon in France called Ambroise Paré. So what was happening in Europe at this time? We had barbers and we had barber surgeons, and the distinction between them is really unclear depending on which country you're in, at which time, and which place. The physicians were the people who did all the intellectual work. They looked at the jars of urine and would kind of forecast what your health was going to be like. The barbers actually gathered the urine, took care of a lot of the manual procedures, and barbers started to deal not just with pulling teeth and cutting hair, but also with a little bit of wound treatment. The physicians certainly weren't going to go out there and cauterize wounds or even suture them up, so the barbers got tasked with more and more of that manual labor. So dressing of wounds is largely what we consider to be the distinction between a barber and a barber surgeon. Now, these people were actually really in a good spot to make rapid advances in medicine. They were allowed to use their hands, they were allowed to experiment, and because they were so low status, no one was really checking up on them. There's a lot of possibility that these people could really improve medicine. The problem is, the Council of Tours in 1163 said, okay, if you have a clerical appointment, you cannot practice surgery. It's not becoming for a priest or a monk or anyone with a clerical appointment to do that. What's the problem? What do priests and monks and other people with clerical appointments do that almost no one else in the medieval world does? Read and write. So then surgery becomes a craft art. It becomes a craft art of largely illiterate practitioners who might be very skilled, but aren't going to be able to pass down what they know in any sort of a sensible way. It becomes something that's taught through an apprentice position, and if you don't pick up what your teacher's trying to tell you, none of the other students do, it gets lost. So that opportunity was pretty much squandered by not allowing literate people to go into this career. Now, FYI, if you can't read, and most of the people around you can't read, how do you advertise? There were no emojis, no pictograms at the time, so you did the next best thing. If you're going to tell people you can help them with their wound, you take a bloody rag and you wrap it around a stick and you stick it outside your door, and that is the barber pole. That's where that comes from in its original format. It was a bloody rag wrapped around a stick to show that this is where you could come to get it dealt with. So, because status is something always in the background, people are always trying to increase their status, distinguish themselves from others, the surgeons and barber surgeons started to squabble amongst themselves, and you started to get segregation of barbers of the, quote, long robe, who wore a long robe, from barbers of the short robe. The barbers of the long robe wanted to become more literate, they wanted to do writing, they wanted to basically become more academic. They wanted to mimic the physicians at the time and kind of remove themselves from the actual manual work of surgery. Now, eventually, this happens throughout Europe. In England, in about the 1540s, the barbers and barber surgeons were segregated into two distinct groups, although they had a single charter. Barbers, what we basically would think of giving rise to barbers now, did not deal with wounds. They dealt with tooth pulling, cutting hair, things like that. And academic surgeons were the ones that could do more advanced interventions. They could actually go in and cut you to try to heal something up. So the red poles versus the blue poles came to be a thing at that point in 1500s England. So medieval surgery was pretty bleak. In Avignon, in southern France, there was a guy named Guy de Chalac who basically was the one bright spot in medieval surgery. He actually was the physician to the popes in Avignon. Now, hands up, what city does the Pope live in? Rome. Did you guys know that there were about 80 years the Pope did not live in Rome? Because I didn't until about a year ago. Okay, good job. So yeah, Avignon is where the popes actually lived for a long time. There was a schism, led to multiple popes existing simultaneously, but at one point, a pope or one of the popes was living in southern France in Avignon. So Guy de Chalac was one of the papal physicians, and the plague was a constant problem in medieval society. It would come around every few decades, and although the earlier spread was worse, it continued to be bad throughout medieval history into the Renaissance. So he actually got the plague, survived, and was able to add a good description of its progress based on his own experiences, as well as being able to follow others as they got it. He described the pneumatic, airborne form of it, as well as the more direct form of it. Didn't quite figure out how it was spread, but described its progression. He advised the Pope to stay indoors and keep two huge fires burning in his chambers all the time, which must have been incredibly hot. He wrote a very large treatise on surgery called Surgica Magna, and did a lot of different investigations. Nothing that really stuck around, but did have a little bit of advancement in surgery throughout the medieval era, so it wasn't all bad. And because he was in southern France, near Spain, near Italy, he was familiar with a lot of the predecessors that he had in surgery and did quite a bit to maintain their works. That also means he maintained their mistakes. One thing Galen said regarding surgery that turned out to be a major problem, because Galen was unquestioned, was that healing, and if you saw thick, sticky white pus after an incision, that was a good thing. It was called laudable pus, because it's probably not going to spread, it's going to stay localized, and it'll probably heal okay. The problem was, he said, you have to see laudable pus. So God forbid you have surgery done and your wound starts healing well. No good. We got to open that thing back up till there's pus there. And guess what? It might not just be staph, could be strep or anything else that gets in there, and then you die. So that idea that you had to have pus for healing to proceed was a problem that was promulgated by all the successors of Galen up until the Renaissance or even into the early 1800s. So in France, as we move into the Renaissance, simultaneously as anatomy is becoming more well described in Italy, we have a guy named Ambroise Paré in France. And he's probably the most distinct figure in the history of surgery that moved it from this kind of stagnant practice to an actual investigative science. So in France, the long-robed surgeons were constantly bickering with the short-robed surgeons because they saw the short-robed surgeons as being inferior. They wanted to be seen more like the high-class physicians, and they required everyone to speak Latin, get a university degree before they could become a long-robed surgeon. Paré was born very poor, and he wasn't able to study, to learn Latin, and get admission into the society of the long-robed surgeons. So he did what a lot of people did. He joined the army, and he worked as a surgeon in the army and got his training there. So he became a barber surgeon and traveled around with the French army. And over the course of his career, in many, many wars, many engagements, he refined surgical techniques tremendously, wrote several books, some of which became surgical mainstays for a long, long time. So the spark that really lit his investigative interest was that at the time, a brand new thing was coming to be more prominent in European warfare. It was gunpowder and muskets, projectiles, artillery, things like that. And the prevailing wisdom at the time was if you got shot, let's say you get shot by a bullet, having that bullet inside you is bad. But what's worse, there are gunpowder toxins. And if anybody's in the other room, I'm holding my fingers up and doing the quotation mark thing in the air. Gunpowder toxins. If you thought people who don't know what they're talking about using toxins to describe any bad thing they don't understand is new, nope, it's been with us for a long time. So gunpowder toxins were considered to be worse than the actual bullet. So how do you treat gunpowder toxins? How do you neutralize them? Well, you don't worry about pulling the bullet out. Instead, you pour boiling oil into the bullet wound. Yeah. So Paré was doing what any good trainee surgeon would do. He was following this advice to try to make sure that the patients would get better because he was unaware that there was anything wrong with this. In one engagement, they ran out of oil, and he had to come up with another way of treating them. He came up with a poultice that he slapped down on there. I think it had turpentine and egg whites and some other stuff in it. And the whole night, he was just racked with guilt, like, oh, I failed my patients. I didn't neutralize those gunpowder toxins. They're going to be horribly ill and dying. It's all my fault. But when he checked on them the next day, not surprisingly, they were better because they did not have boiling oil poured into a fresh wound inside their body. And he didn't ignore that. He started actually questioning a lot of the things that had been received and started really investigating every little thing he could regarding surgery and how to make it more effective. And so he looked at things and did really novel things. He reintroduced the ligature, read about it from Albucasis and thought, I should be able to actually suture things instead of only cauterizing them. He characterized different types of fractures and dislocations, described how you treat them, looked into how arteries can be ligatured above the point where they are open so that you could actually close off the blood and not have the hemorrhage continue, and looked into hernia repair. He did continue the prevailing practice of treating hernias by castration. Yeah. So if you have an inguinal hernia, you might have a loop of bowel wind up in your scrotum, if you're male, and taking out your testicles is not going to fix that. But it was still the prevailing thing at the time. But he did actually look to try to figure out how these things could be made better, and did eventually figure out that you could use a truss or something to prevent the gut from moving out there in the first place if it was still sliding. So because he really cared about his patients, because he investigated the best ways to treat people, he was beloved by the soldiers that he traveled with. In fact, he was smuggled into a city under siege, and they threw a party and paraded him through the streets once they knew he was there, because they knew they'd actually get treated by someone who wanted them to get better. So after his stellar career, it couldn't really be ignored that he was the best surgeon in France, no matter what the surgeons of the long robe at the universities in Paris thought. So the French king basically demanded they let him in. So they waived their examination in Latin, and he was allowed to join the academic surgeons. One of the most interesting things that happened, though, regarding him is that in 1559, Henry II was celebrating the marriage of his daughter to the Holy Roman Emperor Philip II. This was a huge thing. These two countries had been at war For a long time, Henry II had actually been held captive by the Holy Roman Emperor during his childhood. So the fact that they were coming together for a royal wedding to kind of make hostilities come to an end was a big deal. He really liked jousting, and at the wedding he got really loaded and decided to joust, and a bit of the spear that his opponent was coming at him with broke off, went through his visor, and pierced his skull through his orbital bone and out the back of his head. Didn't kill him right away. So they took him to convalesce, and they brought in Ambrose Paré, who was the French physician and surgeon there, and tried to help him treat it. Ambrose Paré had help from the surgeon of the Holy Roman Emperor, Philip II of Spain. It just happened to be Andreas freaking Vesalius. So if you had a time machine, think about where you'd go. I know where I'd go. I would go hang out in this room and check out Ambrose Paré and Vesalius dissecting the heads of executed criminals that they'd rammed spears through to see if they could figure out some way to treat the king before he died. Now, obviously, having a spear go through your skull, apart from the horrific injury, is going to lead to some infection, and the king did indeed die, but not after the two greatest experimental scientists of the age did their best to help him out. Now, I have nowhere else to put this slide, so I'm going to put it here. So, there's a lot of weird things that have happened, but one of the strangest ones is that there's a surgery that's appeared in multiple cultures, and it stuck around for a little while, but usually fell out of favor, and it's because it was a surgery that was intended to get around a criminal punishment. So if you committed certain crimes at various times in various cultures, you'd have your nose cut off. At various places in India, but also in the 1500s in Italy, transplants were conceived of where you could actually take a skin flap from, in this case, your bicep area, cut it, seal it up to your nose, and sculpt a new nose out of that. So this procedure was frowned on, not only because it was odd, but because it was getting around a criminal punishment. So much so that the major surgeon who promoted it in Italy, after he died, was disinterred and put into unhallowed ground because it was so frowned upon. Now, skin flaps and vascularized flaps are a massively important surgical procedure these days. You can do a ton of amazing stuff with vascular and muscle grafts, but it wasn't something that was experimented with as much as it could have been because we had such an early start in that idea. So just tantalizingly interesting to think what could have happened if these grafts had been experimented with a little further. Quick aside, a guy named Ralph Gurr is a surgeon who passed away a while ago, but he did an amazing set of vascular and muscle graft surgeries on people. Who's heard of prune belly syndrome? Anybody? It's called prune belly syndrome because when little kids are born with it, they're born without any abdominal muscles. So there's skin, fat, peritoneum, and then just intestines. So they have little pruny-looking stomachs because there's nothing over their intestines. Now, they also tend to have massive renal problems, but if they can get the renal problems taken care of medically and eventually with the transplant, that lack of abdominal wall musculature becomes a big problem. Ralph Gurr did this great thing where he took this 20-year-old with prune belly syndrome and detached his rectus femoris muscles on both sides, flapped them up, fanned them out onto his rib cage, and after about a year of rehab, this guy was able to do sit-ups because he now had an abdominal wall. So the most amazing part, though, is when he first got done with the surgery, every time he'd go to take a step forward, he'd lurch his body because his brain thought step forward equals contract those muscles. So reprogramming the brain to recognize that that was no longer going to be the case took quite a bit longer. Okay, so back in time, like I said, I had no better place to put that slide, but I like it, so there we go. So let's talk England. We'll come back to France. The British physicians, surgeons, and barbers were all very, very segregated from one another. They were not allowed to poach on each other's activity. In fact, have you ever heard of a physician or a doctor called a quack? These days it means a fraud or someone who's bad at their job. The original meaning of quack is someone who stole other people's patients. So if you're a physician, you didn't do an apothecary's work. If you were a surgeon, you didn't try to prescribe medicines. A quack was somebody who trespassed on someone else's professional domain. So Henry VIII, and if you know nothing about British history, Henry VIII is probably the king you're thinking of when you think of British king. He's the one with all the wives, cut off their heads, yada, yada, yada. One of the other things he did was chartered the surgeons and barber surgeons together and kind of laid out what their jobs were. The British surgeons, and this is all of them, received 2 bodies a year for dissection. The Scottish surgeons only got 1, but for some reason also got the whiskey monopoly for Edinburgh. Pretty good deal. So that's how they were allowed to investigate and hone their craft. 2 bodies in England, 1 body in Scotland. Speaking of Scotland, Scotland became a major hub for medical and anatomical research. It really became a place where surgery progressed. And it was largely at the University of Edinburgh, and there was a family of anatomists there, and they held, the family, the father, the son, and the grandson held the chair of the department for 126 years. And they all had the same name. We had Alexander Monroe the first, Alexander Monroe the second, and Alexander Monroe the third. The first 2 were really good. Alexander Monroe Tertius was apparently a terrible teacher. He didn't show up prepared. He just had his grandfather's notes and would just read off them to whoever happened to be there. Didn't really care to grade stuff. He was actually, he taught Charles Darwin, and Charles Darwin actually has notes like just excoriating how much he hated him. So not a great teacher, but there were several others in Edinburgh that really made anatomy teaching come alive. But because Alexander Monroe Tertius' teaching was so bad, but people needed to know their anatomy to be surgeons, there got to be a really thriving industry of private anatomy schools that the students would go to. So how would you guys like it if I said, you know, I'm going to I don't want to pick on any one faculty member in particular. So somebody throw out a discipline, phys pharm, micro, whatever. Okay, neuroscience. Dr. Morse Wyman has volunteered. Let's just say, oh, you know, neuroscience at WSOM, not so good. But down the street, if you pay another couple $100 a month, you can go take another neuroscience course from so-and-so. That's what was going on in Edinburgh at the time. So what happened? You have a need for bodies. You don't have an official way to get bodies. And in Edinburgh, body snatching, and other parts of the country too, but especially Edinburgh, became a major problem. People would actually install these things called Mort Saves above their grave to discourage anyone from stealing their body until rot had taken hold and it was no longer useful. So about 2 weeks these things would be stuck there. But body snatching became almost a small industry in places. And the most famous incident of body snatching was in Edinburgh. It was these guys, Burke and Hare. Because, as the story goes, they were running a tavern, which also allowed people to stay overnight, and they had one of their clients die. And he hadn't paid his bills, so that, let's give the body to the anatomy school. And they got a lot of money for it. Then they thought, you know what would be a lot easier than waiting for people to die? Just flat out killing them, and that's what happened. And these guys just started killing people and delivering them to the anatomy school. So, yeah. Now, that may not seem like the perfect thing to turn into a feel-good comedy, but it's been done, and it's hilarious. So Burke and Hare, starring Shaun of the Dead and Gollum up there. It's great. That's really them, Simon Pegg and Andy Serkis. It's a fun movie, actually. It's all about murdering people for anatomy, but anyhow. So what really happened was that eventually it all fell apart. Hare turned state's evidence against Burke, and Burke was executed, and, poetic irony, his body was given to the surgeons to dissect, and you can go see his skeleton in Edinburgh to this day. And there were also books that were bound in his flesh, or his skin, rather. So his skin was tanned to make leather, and books were bound in it. It's a little bit of punishment after the fact. So that's what's going on in Scotland. We'll come back to a little bit about the people involved. The guy that they were selling bodies to was called Robert Knox, and he was a very well-known anatomist and surgeon in Edinburgh at the time. We'll come back to him when we talk about anesthesia. But just be aware, they weren't just selling to anyone, they were selling to a very renowned anatomist who only escaped with his reputation intact by kind of playing the authorities, pretending he didn't know that something shady was going on about the bodies he was receiving. So, 2 other famous Scots moved down to England, and were in London. This was William and John Hunter. So surgery had gotten a little bit better. Ambroise Paré in France had made a little bit of experimentation the norm, but it was largely considered to be inferior to medicine because it was manual labor and it didn't have a firm scientific backing most of the time. That changed with the lifetime of one person. John Hunter took surgery as a craft art and made it into an experimental science. Now, one thing I want to do to kind of get a sense of this is, when you hear that someone is a surgeon, well, same game we played before, does that sound good? Johnny just became a surgeon. Does that make you happy for the person who just told you that? So back at this time, surgery was very low status. So are there any ENTs in the room? Any emergency medical technicians? Anybody do that? Just one? Just a couple? Anybody? Okay. Would you say you felt respected in your role as a medical technician most of the time? A lot of times people talk badly about people who are using the ambulance, moving them from place to place. Surgery was what, at that time, was pretty much what ENTs are now. People who do really good work and are trying to help you, but don't necessarily get the respect they deserve. John Hunter is the person who changed that and made it not only an experimental science, but a high status for people, a career for people to take. So William Hunter, his older brother, was a respected anatomy instructor and obstetrician in London. He brought John to London to help him. Now, John Hunter was a pretty hopeless student. He hated studying. He didn't like reading. He never wanted to learn Latin. And he basically just wanted to wander around and watch animals move, check out plants, how they grew. He really wanted to just observe things. So he wasn't much good at school, so as a little bit of a charity, his brother brought him to his anatomy school and helped him do his research. And John Hunter was a fantastically skilled anatomist. He really liked dissecting. He investigated everything he could, did phenomenal work, described it well, wrote it up well, and was pretty soon running the entire anatomy school on behalf of his brother. So he couldn't really go any further without getting some schooling, but his attempts to go into school were pretty hopeless. So he did what Ambroise Paré did. He joined the military and became a naval surgeon and went around the world, learned the rudiments of surgery that way, and when he came back to London, that was enough to get his foot in the door so that he could train with some of the more high-status surgeons in London at the time, people like William Cheselton and Percival Pott, learning things that were going to become the fields of lithotomy and orthopedics. But John Hunter, had a massively just unquenchable thirst for knowledge. He wanted to work all the time and learn everything he could. He worked roughly 19 hours a day, woke up, wrote, dissected, visited patients, worked in the hospital, did his research, worked with pupils who lived in his huge house, did their dissections, went to bed, got back up, repeated. His need for specimens to train his students and do his research turned the local body snatchings into a cottage industry. It became something people got really good at. They'd go to the graveyard, dig about a 2-foot hole down to the head of the new grave, snap off that part of the top of the coffin, and just pull the person up by their shoulders. So very little disturbance of the earth and very quick work. So there's a huge group of body snatchers supplying John Hunter. And it was absolutely illegal to steal bodies. But England, being what it was with the class segregation at the time, no one was going to think of taking that to John Hunter, the respected surgeon. They were just chasing after the people doing the dirty work. So he paid a lot of money to get the bodies he needed to do research, and he was obsessed with unusual people. So the story that really typifies that is there's a guy named Charles Byrne who was over 7 foot tall. He had what we'd now consider to be a pituitary tumor that caused growth hormone to be released excessively, and he had gigantism. So in Victorian era England, if you've got something weird going on with you, how do you make money? Yeah, you join the circus and you show yourself off to people. They pay good money. You tour around the world and actually make decent money getting yourself displayed as an oddity. So that was going pretty well. However, Hunter visited Charles Byrne and unfortunately told him, when you die, I gotta dissect you. Charles Byrne didn't like that. He staunchly believed, he's a good Catholic, he believed his body had to be whole when it was buried or else he would not be resurrected properly. So his health was failing. He knew Hunter was coming for his body. So he arranged with the mortician to be buried in a stone coffin that would be thrown into the North Sea. Hunter counter-bribed the mortician, followed the funeral group out. When they stopped for the night to rest at a tavern, the mortician came out, opened the stone coffin, body was swapped out with stones, and pretty soon, the skeleton you see right there was hanging in Hunter's laboratory. So, in addition to his house, he had a country estate that was packed with exotic animals that he could get. He didn't kill them, but he would take them in, and when they died, he'd dissect them. But he had all kinds of animals from all over the world. The guy who wrote Dr. Dolittle lived down the street from him. They think John Hunter might have been the inspiration for Dr. Dolittle in that regard, because he had all those animals running around. He was instrumental in founding the Veterinary College of London. He got dentists a lot more recognition because he did a lot of work with dental development, both in human and animals. He did comparative anatomy dissections that were just unbelievable. That picture, those are his dissections. And that's not a museum, that's his house. He had a house built that was basically a museum with a huge viewing room, and all his specimens were there. He could teach from it, people could tour it, and so forth. Now, we mentioned Dr. Dolittle. His work on whale anatomy is cited as the inspiration for Moby Dick. It was written because Herman Melville read Hunter's work on whale anatomy. And who's read Moby Dick? Okay, yeah, okay, thanks for the honesty. Did it seem weird that there was like a weird spot in the middle where they just talked about whale anatomy for no reason and the story totally got interrupted? Thanks, John Hunter. Okay. So, based on examination of mastodon teeth, he actually said something that was very controversial at the time. He said certain animals had gone extinct. Everything that had been created was not permanent. Things could go extinct. And he figured that things could evolve from one species to another. Now, his writings on evolution were considered to be really, really suspect, and they were given to the Royal College of Surgeons, but they weren't published until 7 years after his death, right after Charles Darwin had published, and the College of Surgeons said, hey, Hunter figured this out like a long time ago. Now, point of fact, Hunter said that he thought evolution occurred, but he never gave a mechanism. That's still Darwin coming up with natural selection as a driving mechanism for it. But Hunter came up with a very similar concept, but not the mechanism. So if that weren't enough, he also did a lot of auto-experimentation on lots of different things. To keep himself working all night, he would sometimes jump up and do jumping jacks to get his blood flowing if he was sleepy. And one time, he popped his Achilles tendon. It snapped. Now, what do most normal people think when they pop their Achilles tendon? One word, well, okay, a word. One word you can say publicly. Ow. Hunter probably said ow too, but then he said, I wonder what would happen if I cut the tendons of other various animals and then saw what happened as the healing proceeded. So he then, using himself as the first subject, figured out how he could experiment on tendon healing and tracking the process of how those things get better. One thing I should have mentioned, he did the first aneurysm repair that ever worked. Popliteal aneurysms killed lots of people in Victorian-era England, that period of time all over the world. Popliteal aneurysms aren't as big a deal today, because people today don't do a certain thing that most people in the 17 and 1800s did. Anybody want to take a stab at it? What's that? No, that's not how they treated it. But why did people develop popliteal aneurysms? So your popliteal artery, back here, from bending, but bending while riding a horse. So horseback riding put a lot of kind of push-pull pressure on that vessel, and people develop those aneurysms. And if they pop, if they got ruptured, you could die. He did investigations on the arteries around the knee, like all those genicular vessels you guys had to memorize, and figured out, if I ligature this, I can seal off the weakened area, and the leg and the foot will get cold, but eventually the collateral blood flow is going to enlarge and it'll get fixed. And he was right, and he was able to save people who had these popliteal aneurysms that otherwise would have disabled them and then killed them. Now, last horrible Hunter story for you, though. At the time, syphilis and chlamydia were considered to be two separate diseases by some and one disease by others. There was a lot of controversy about whether they were one disease that manifested slightly differently or two separate diseases. Hunter decided to take matters into his own hands and paid a sailor who had syphilis for some of the purulent exudate from his penis, and Hunter then scratched his arm and gave himself syphilis and then tracked its progression. Sadly, he came to the wrong conclusion that they were in fact the same disease because he had a sailor who had both chlamydia and syphilis. So bat can't hit a home run every time. And his mode of death was very much like in the same vein. He had angina. He knew that his heart was getting weakened, and he knew what was going to happen. He knew his anatomy. He knew the clinical progression. And one day, in a very heated exchange with the hospital administrator, he had a heart attack. And he ran to a mirror and started writing down what was happening to him and dropped dead. So that's dedication to your craft. So that's John Hunter. Oh, by the way, this book is fantastic. If anyone's looking for some Christmas time reading, and you want people to leave you alone when they see what it looks like on the cover, this is a good way to go. So great book, The Knife Man, Life of John Hunter. I want to mention, I think the world of John Hunter, but the moral ambiguity in his life is just unbelievable. You can respect what he did while be horrified at what he was willing to do to get his work done. So let's jump back into France. Hunter had to make surgery respectable in England through his entire career, giving it a solid scientific basis, treating very well-known, very prominent people. Surgery became respectable in France all at once. And it happened because Louis XIV had an anal fistula. Now, if you don't know anything about history and you think of a famous French king, you're thinking of Louis XIV. He was king for over 80 years, and he had an anal fistula. An anal fistula, for anyone who doesn't know, is when a channel develops from your anus or rectum out to the outside of your body, bypassing the anus. So it's another channel that material can get in. It gets inflamed and infected very easily. It's very painful. So he was tired of it. So he said that the court barber, a guy named Charles Francois Felix, had to operate on him and get rid of the fistula. How would you like to be that guy? You have to perform surgery on the anus of the King of France, and your life is in your hands as you do so. So, got to find a way to fix that. What Felix did is he found peasants who had anal fistulas and, convinced / coerced them into having the surgery done. None of them survived. But he got enough practice on the technique that he was able to do the procedure on Louis XIV, and Louis XIV survived. Now, my opinion is he probably had the technique down relatively quickly, but if you're going to operate on the anus of the King of France, what do you do to your instruments first? You probably clean them, and that might have been the thing that made the difference. But it succeeded, and he was made a baron. The king, Louis XIV especially, of all the kings, just said, hey, you know what, surgery's good, and surgeons are now chartered, they have university posts, and we're going to give them a lot of rights to choose what happens in their governance and bringing in new surgeons. So chairs of surgery were endowed in Paris and other places. They became professionals, and they were able to set standards that their peers had to meet, making them a profession. After the French Revolution, the distinction between physician and surgeon was just wiped out, and people were called health officers. So again, the Revolution did some pretty good things. It wiped out some barriers, made it easier for people with unorthodox ideas to advance, and did some horrendous things like killing a bunch of people through guillotine and upsetting a lot of the procedures that had been in place before that. So when you throw out all the bad stuff, some of the good stuff gets out too. All right, we've got 15 more minutes. I think we can get started here. So surgery has become technically more capable. We actually understand what the anatomy is. People have good technical skill. It's also prestigious. You don't have to go to a back alley surgeon to get something repaired. It's something you can actually say without shame, oh, I need to have my finger amputated, and people aren't going to be horrified. But you are probably still going to die. And not only were you going to die, it was going to hurt. You were going to die because a lot of things got infected. No one understood germ theory. There was no inkling that dirty instruments could lead to an infection. And it was going to hurt because there were no very good anesthetics available. So I'm going to start by talking about how surgical anesthesia came into existence, and then we'll finish up next time by going from how surgery became antiseptic and aseptic. So pain-free surgery had been something people have been looking for probably since ancient history. Alcohol, opiates, and just speed of operation were all things people employed to try to make surgery more bearable and get it over with quicker. Now this picture is a falciform knife, and it was the knife that you would generally try to use for amputations. So, to give you a little state on that, basically, if I had to amputate someone's leg, or at the thigh, they'd clamp down on their femoral artery, try to restrict the blood flow as much as they could, and then the surgeon would take this knife, wrap his arm as far around as he could, and try to make one massive sweep to slice open the quadriceps, the hamstrings, the adductors, everything that they could, and go as quickly as they could, drop the knife, use a saw to cut the femur, and stitch it up as quickly as possible. So, Dominique Larrey, another French surgeon, after surgery had become respectable, after the Revolution as well, did 200 amputations within a day during the French-Russian battle at Borodino. And what's interesting about it, other than the sheer ridiculousness of that number, is that the soldiers who were brought to him had been left on an icy battlefield, and he noted that the people who'd been iced didn't feel the pain as much. So he started using ice and snow to try to pack the areas that were going to be amputated to try to make it more bearable for the people who were undergoing that. Now, he does a pretty good thing. He took advantage of the situation that was there. He also introduced battlefield ambulances, basically going to get the wounded people instead of just leaving them there to die. That was an innovation that didn't come until the 1800s. So actually trying to get people to treatment after the battle. So, it's time to get a little bit patriotic. Because the first major thing that America ever contributed to the history of medicine is surgical anesthesia. So, yay! Come on, USA! But your muted response is probably appropriate because it's a horrible story. So, let's get started. Back in the 1800s, if you wanted to go out and have fun, you couldn't really go to too many plays. There weren't that many available. There were very few places that had operas. There was no television, no internet. So one thing people would do to pass the time is they'd go to laughing gas parties. And you'd sniff nitrous oxide with your friends, and you'd be silly and laugh, and it was a good time. A dentist named Horace Wells went to a laughing gas party with his friends, and there are various versions of this story, but the main one that's easy is on his way back to his seat, he just rammed his knee into another seat, sat down, and didn't feel the pain until the next day. Being a dentist, he thought, I didn't feel that at all. Maybe I could use that to extract teeth. And he started experimenting with nitrous oxide, and lo and behold, it actually worked pretty well. He could extract teeth relatively painlessly. And then he thought, I should actually see if this could be for more than teeth. And so he arranged to do nitrous oxide anesthesia on a man who was going to have a surgery done in Boston General Hospital. The guy backed out because a lot of people did back out on surgery back in the day because you were likely going to die and it was going to hurt. So he just asked in a crowd a lot like this, and if you go to Boston General, you can actually see the pictures of what the room looked like. It was a lot like this, kind of an amphitheater. He had a medical student volunteer who needed a tooth pulled. So gave him some nitrous oxide, pulled the tooth, and the student later said, I didn't really feel anything, but when the tooth got pulled, he jerked out and kind of said like, ah, like made a little bit of a pain noise. And at that point, everybody in the room was like, this guy's a jerk. And they just started just throwing abuse at him and, kind of like calling him a fraud and shutting him out. They were a lot meaner back then. They didn't hear professionalism 20 times a day during their orientation. And the most horrible thing they said as he ran from the room in shame was, humbug! Apparently that was a real cutting remark back in the day. Back before Ebenezer Scrooge sanitized it for all of us. So he left in shame. A student of his, a guy named William Morton, decided that was not good enough and that they could do better, and it was still something to it. He wanted to keep going. Now, in addition to laughing gas parties, another thing people would do, that you're going to understand immediately, is for fun. They would have ether frolics, where you'd sniff ether and then act silly and sing and dance, and your friends would laugh, and it was a good time. But same deal. Ether would render people insensible. And so his student, a guy named William Morton, decided to experiment with ether anesthesia for pulling teeth, because he was also a dentist. And almost a year to the date of that failed demonstration, he went back, and the same surgeon, Dr. John Collins Warren, did a surgery with ether anesthesia. And this was not a minor surgery. This guy had a large, I think it was a submandibular gland tumor that had invaded a lot of tissues. Imagine cutting a tumor out from under someone's jaw with no anesthesia and only big burly people to hold them down. So this surgery is going to be slow under the best of circumstances. So John Collins Warren allowed this to happen. Very respected surgeon. It was really good that he just didn't say, oh, it's inevitable, don't worry about it. So ether anesthesia was given. The patient didn't move. The surgery was a success. It got removed without the guy twitching. In fact, when he woke up, he asked when it was going to start. So this was obviously a huge moment. And the purported thing that John Collins Warren said to the students, many of whom were probably the same people who booed the other guy out earlier, was, "Gentlemen, this is no humbug." So if anybody wants to bring humbug back, you got my backing. I think humbug needs to resurge. All right, so this was obviously a huge deal, and everybody in Boston knew this was a big deal. This is where human greed enters the equation. Because this is ether. Ether's been known for a long time. Ether can be made by anybody, and no one can patent ether. So William Morton, this guy, who successfully administered it, decided to try to patent it by adding a lot of little scents to it, diluting it a bit, making it unclear that it was ether. But people at Harvard who he'd worked with knew it was ether. They knew the secret. They knew he was just trying to patent it to make some money. And rather than just saying it's ether, they decided they wanted a cut of the action as well. So this guy, Charles Jackson, had said, come on, you worked with me to get this ether and kind of come up with this experiment. I deserve equal rights to any of the proceeds. So they started marketing it as Lithion. Then they both started kind of chipping away at each other in the press and infringing on each other's patent. And they just hated each other. And they'd go back and forth. William Morton had a history as a con artist. He would actually have to go to town, selling things, buying it on credit, and then not paying his debtors and running to the next town. So he was already a shady character. Charles Jackson was a very well-respected academic, but he had this real tendency to think he deserved credit for other people's discoveries. He thought he came up with Morse code before Samuel Morse and that he'd had it stolen from him. He thought he had come up with TNT before Alfred Nobel and it had been stolen from him. And he was damn sure not going to lose out on this ether-based anesthesia, which he may or may not have had a major hand in creating. So these two just constantly bickered with each other. And it became a real national embarrassment. Meanwhile, the cat was out of the bag, and people using Lithion, their proprietary blend, or just ether, were doing surgical anesthesia all over the world at this point. So the United States government decided this was a horrendous waste of time and a national embarrassment. They put up a $100,000 prize in $1860, $100,000 prize for anyone who could prove priority. William Morton went to D.C. to press his case, but on the way suffered a stroke and died. Several years later, Charles Jackson was at a cemetery at a funeral in Cambridge, Massachusetts, and walking through the cemetery, came across William Morton's tombstone, which said, "Inventor and revealer of anesthesia, before whom in all history," let me see if I got it here, "before whom surgery in pain and surgery was annulled and averted, before whom in all time surgery was agony." Charles Jackson went acutely psychotically insane and died in an asylum after that, never having recovered his senses. And is buried in the same cemetery in Cambridge, Massachusetts. Someday I'll make a road trip up there and get my own pictures of these headstones. Meanwhile, 4 years before the demonstration at Boston General that comes out, a rural physician named Crawford Long in Alabama had done ether anesthesia and removed several small tumors and other things like that, doing short operations, and didn't think it was a very big deal. It was only when the U.S. put up a $100,000 prize that his friends said, "Crawford, you really got to tell people that you did this." So who deserves the credit? The person who did it first? The person who publicized it? It's hard to say, but nobody except for Crawford Long behaved themselves in anything close to an admirable way in discovering surgical anesthesia, which made the most painful possible thing painless. So Crawford Long never really got the prize either. He didn't really pursue it that heavily, and he died as he lived, a good rural surgeon and physician. He was delivering a baby, handed the baby to his nurse, and fell over dead. So sudden death, but at least a dignified end. So word from Boston got to England and Scotland very, very quickly. And they particularly got to the ears of a guy named Robert Liston. Now, he was a very well-known surgeon, really flamboyant, really vociferous, really willing to push his case, and he had tried various things to null the pain of surgery. He tried mesmerism, actually having people hypnotized through the techniques of Franz Anton Mesmer, and it worked, but it took several hours to get someone into a trance-like state where you could cut them open and they wouldn't feel the pain. But as soon as Aether came along, he suddenly realized this was amazing and it was going to be great. And he was already a well-known surgeon. I mean, credit to him. He always kept looking for innovations, even though he was very secure in his status. Now, he was not only renowned as a surgeon, he was also the fastest amputator maybe in the world at that time. Generally, he could remove a lower limb in 2.5 minutes. That includes the suturing at the end of it. But there are also some problems. Sometimes you take off your patient's testicles if you cut a little too high. Sometimes you take off the fingers of your lab assistants as you cut. These things all happened. And he had one surgery that had supposedly, I've never heard a definitive, this definitely happened, but it's a folktale that's kind of spread everywhere. So it may have happened, maybe embellished, but supposedly he had a 300% mortality at one surgery. And the reason is, he was doing a thigh amputation, did the quick cut around the thigh that we discussed earlier, and took off 2 of the fingers of his assistant. The person who was on the table got a surgical infection and died. The assistant got a surgical infection from the amputated fingers, also died. And as he was cutting, he realized his patient, and not only his patient's leg, but his assistant's fingers had been cut, and he kind of jumped back, and the knife went backwards. Didn't actually cut someone in the audience, but an old man who was really close saw the knife coming at him and had a heart attack. So that is the only recorded surgery that we supposedly know of, although I haven't gotten firm confirmation it actually happened, with a 3,000% mortality rate. Other fun story about Liston is one of Burke and Hare's victims was a woman in Edinburgh. She was down on her luck, and Liston had actually worked with charities to try to help people in Edinburgh. He was Scottish himself, and he heard that this woman had been murdered by Burke and Hare, and her body was in the dissecting lab. And he went up there and punched Robert Knox, the other anatomist, out in front of his students. So if Dr. Krychek walks in here and gives me a slug, that'd be kind of what happened. You're just talking, all of a sudden, oh, hey, and punch down. So that's another story related to him. And I also love his quote upon doing Aether Anesthesia for the first time. It's not quite humbug, but it's pretty good. It's like, this Yankee dodge beats mesmerism hollow. Translation, this American technique of Aether Anesthesia is better than hypnotizing people. All right, we're almost there. Finish up. So the next step was not a huge one, but an important one. Aether Anesthesia was fairly difficult. You had to really keep a close eye on the person as they lost consciousness, monitor their breathing, and it could be really different from person to person how much ether it took. James Simpson, this guy, investigated other things and came across chloroform. Chloroform was more potent. You didn't need as much of it. It wasn't as irritating to the passageways. And chloroform had other problems, let's be clear, but it had a quicker action. It was less irritating, and it was a little bit easier to apply, especially if somebody was in a traumatic state and you had to operate on them and they were flinging themselves around. The way he discovered it was really interesting. He had a group of friends who would meet for dinner, and after dinner they would test various anesthetic compounds. And they tested chloroform, so they opened up a bottle of chloroform, and the story goes, the next thing they knew, they were waking up under the table. So they opened the chloroform, they all passed out, and thankfully, I guess there was enough ventilation, they didn't die. But they figured at that point chloroform was actually very potent. So, anesthesia, obviously a great step forward. Still a lot of detractors, though. It was not always seen to be a massive step forward, particularly when it was put to work in women who were giving birth. It was thought that women were supposed to be in pain during the birthing process. And this quote, yeah, obviously I'm not a believer in this quote, but one person went on record saying that this anesthesia during the birthing process would rob God of the deep and earnest cries of a mother in labor. So anybody who has an opinion on that can, mentally punch the person who said it in your mind. They're long dead, but go ahead. I don't judge you. All that debate ended very suddenly in, not surprisingly, a very regal way. because John Snow, the same John Snow who figured out that the cholera epidemic could be cut short by taking the water supply out of a certain area, was able to administer chloroform to Queen Victoria when she gave birth to one of her children, Prince Leopold. And when the Queen does something, controversy's over. And that's how anesthesia became more pronounced and more acceptable during childbirth. All right, I think that's it for today. Next thing, we'll talk about how microbiology in surgery brought surgical sepsis to an end. Thank you. Thanks, everybody.